So, let's have a conversation about sickle cell. I'm sure you've heard a lot of myths about sickle cell, persons who are suffering from it, and how they are not fit to live and they are going to die eventually. Well, today we'll try to break all those myths for you on the show. I'm joined by Dr. Vanessa Mensah-Kabu. She's a medical doctor, and Nana Esi Duka. She's a Sickle Cell Awareness Initiative founder. Welcome. Good to see both of you.
Thank you.
So, first of all, I am sitting here and I've heard lots of myths about sickle cell, but really, what is sickle cell? I'll start with you, Dr. Vanessa.
Sickle cell disease is a group of blood disorders inherited usually by a person's parent. So it's not a disease that you can get from a friend. It's something that is passed on from one's parents to them, and then it goes that way. So in a nutshell, that is what sickle cell disease is.
Okay. How do persons who suffer sickle cell look? Because I've heard a lot of people who have the sickle cell disease are always very tiny. They are unable to get big, grow fat. How? I mean, if you can break that down for me.
Okay. Well, so sickle cell disease is actually a very broad topic.
Yeah.
But we'll focus on the most common, which is sickle cell anemia. And that most often has the features that we see, like the frontal boson, that's the, in quotes, big forehead.
Okay.
The natopathy, that is protrusion of the upper teeth. And then the dactylitis, very tiny, slender fingers, amongst others. Yeah.
Okay, but I'll come and ask you shortly why you decided to set this up. But Dr. Vanessa, there's a lot of stigmatization against persons who have the sickle cell disease. Is it because people don't know what it's about, or it's just how sometimes they appear that makes us stigmatize against them so much?
Well, I would blame majority of the stigmatization on the fact that there is not enough awareness. You most likely or are most often tilted to condemn, if I should put it that way, what you do not know about. So creating awareness, educating the public on what sickle cell anemia and sickle cell disease is, allows us to understand it to an extent and show love, support to each and every one who has sickle cell disease or sickle cell anemia.
Okay. Nanesi, why did you decide to set this up?
Well, thank you for your question. So I have sickle cell myself.
Oh.
And so, yes, I wanted to be a myth buster.
But you don't look anything like what I've heard.
Exactly. You don't have to look a type of way, which is one of the things and the falsities associated with sickle cell is that you look slender, you look frail, you're fragile. And so we want to push the education and advocacy to say you can live long and live strong with sickle cell. You can have a long lease on life. So it was very important to me that I take advantage of any opportunity to let people know that you're okay, you could be fine, you will be fine. And so let's stop the stigma and let's enjoy life. Let's give people who suffer from sickle cell or deal with sickle cell the avenue to feel like they're accepted in society and they can be fine and live well. Yes.
When did you set this up?
In 2018, we formally launched, but we've been doing a lot of work since 2015.
Okay. Do you think that you've been able to achieve any success in terms of, less people being stigmatized since you started this?
I will say we're driving a conversation, which is important. We're getting the message out there and people are talking. When we started this month, we're running I Am Not a Sickler campaign, which is something that's very important. We're running an anti-stigmatization campaign because you'll usually find that people who have sickle cell, they are referred to or branded as sicklers.
Exactly.
Yes. And we're trying to say, I'm not a sickler, right? I'm not a sickler. I am an educationist, and she's not a sickler. She's a doctor if she had sickle cell, so we ran this campaign just so we can address those issues and say, let's stop with the stigma, let's drive conversation. We actually had a couple of doctors actually reach out to us and say, we work at 37, we saw the campaign, we use the word, we don't mean any harm. And so these are the things where if we can start to bridge the information gap and get information out there, get awareness out there, should help.
Let me come to you, Dr. Vanessa. I know I speak with persons with disabilities. They say, instead of saying a blind person, say a person with visual impairment, or, you know, those things. So someone who is suffering from sickle cell disease, what is the best way? That's what I've just said. Instead of saying or calling them a sickler, which I am guilty of. I mean, unfortunately.
Well, that is, we're all guilty of it, especially in the medical fraternity. Because at the end of the day, a person's medical information needs to be known for us to administer the adequate management for them. So when you come into a clinic, the first things we ask you are your presenting complaints, and then we ask you about your history, and subsequently we ask you about your past medical history. Do you have sickle cell disease? Do you have hypertension, diabetes, asthma, all of those things? Because that informs our management and also gives us an idea of what the diagnosis would be. So if a person comes into the clinic with severe pain in their joints, you'd be thinking, okay, could this person have sickle cell or something like that? So you ask, do you have a history of sickle cell? That way you would know whether, okay, this is what I'm going to need to do for the person. This is what I'm going to monitor for the person. So each and every person that comes into the consulting room is not managed as a general, is managed as an individual. So yes, we do use that term in the medical field, but it's not to mean any harm or to cause any stigmatization, but only to pre-inform us and any other person that is managing that individual.
Okay, so let's understand this properly. Nanesi is seated here.
Yes.
Like I said, she doesn't look anything like the myths that I've heard about persons who have the sickle cell disease. But you see some, and it's quite glaring. They look sick. They have very slender fingers.
Yeah.
Is it a different type of sickle cell, or is because they do not take care of themselves well? Maybe they do not have the resources that Nanesi has got. What exactly is it?
Well, like I mentioned prior, sickle cell disease is a very broad topic. And the most common one is the sickle cell anemia, which is what the features are what I mentioned earlier on. They are the ones that tend to have majority. They are the SS. So we have those who are SC. We have those who are just carriers of the sickle cell.
Okay.
Yes. So there's
the SS are the ones who cannot marry the SS. They say.
I wouldn't put it that way. Yes, there are complications to each and everything, but with the right support, the right care, each and every person should be able to achieve and fulfill their maximum life expectancy. It shouldn't be because I am AS, so I can't marry someone who is AS. Why not? Because you're going to have a child who is SS? You know, so I think that shouldn't be a reason why someone shouldn't get married. You just have to pre-inform the individuals that these are the chances. You stand a chance of having a child who is SS. So these are the complications, so these are the things you should look out for in that child. It's going to be difficult, but are you ready for that? You shouldn't just go straight on and say, no, don't get married. Let them know why they can't get married and let it be their decision as to whether to get married or not. That is what I feel it should be.
Okay. Now, I know that you say it is sort of hereditary.
It is.
But can it be cured?
Ooh, wouldn't we all like that? Well, a very small percentage of people suffering from sickle cell can be cured by bone marrow transplants, because that is basically where the blood cells are produced. It's a very small majority, a very small population of people. So I would say it's a yes and a no. It's more of a supportive management or treatment that we offer to the individuals with sickle cell.
Is it expensive to manage?
Yes and no. Yes, because it depends on the complications that you're presenting with. Some would need spleen transplant. Some would have to have their spleens taken out. That is surgery. That is if you get into that complication. Some would also just need pain management. Some would just need hydration. So you explain all of these to the individual, and once they tend to take care of themselves, hydrating properly. If they have pain, they should take the adequate medication for it. And if they feel that they are having severe pains, we have so many different complications of it, and they are based on different classifications and severity.
Nancy, we have to go, but I want to get a bit personal. Since you're an ambassador, an advocate of the sort against the I'm a Sickler campaign,
Yes.
which one are you suffering from, and is it expensive?
So SS, which is branded the most severe. I would say, like Dr. Vanessa said, yes and no. There are some times where I've had very severe complications, and that does cost some money. But a lot of the WHO says that sickle cell, most of it, up to 70% of cases and deaths associated with sickle cell could have been prevented with simple, cost-effective interventions. For example, 5 cedis will get someone who has sickle cell folic acid for 1 month. So there are a lot of cost-effective interventions that are available to people, and education is the way to go. Hydration, for example, plenty of water. If you have access to clean water, you know you should be hydrating, and that prevents a lot of painful crises. So yes, it can be if you have very severe complications, but for the most part, up to 80% of deaths can be preventable.
Okay.
So,
all right. Thank you very much. They had a video which we had to show. Unfortunately, because of time, we cannot show it. But I will post it on my personal page to drive the campaign and support it for you. I don't know what your plans are with regard to the initiative. If you're going to set up like a fund sort of to support persons. Do you have that
Yes, we do. There are multiple avenues to support us and to get information. So if you look us up anywhere, Sickle Cell Awareness Initiative, on social media, on digital platforms, you should be able to find us and get the information.
Thank you very much, Dr. Vanessa Mensah-Kabu. She's a medical doctor, and Nancy Duka is a Sickle Cell Awareness Initiative founder. She doesn't look anything like what we think, and so we need to stop the stigmatization against persons who have sickle cell disease. Thank you very much for coming.